Hi, good evening. Today we will discuss about the breathing sounds, normal and abnormal. Breath sounds are the sounds produced by air moving through the respiratory tract during breathing. Nurses listen to these sounds using a stethoscope during lung auscultation to check the condition of the lungs and the airways. First we will see the normal breath sounds, later we will move on to the abnormal sounds. First is vesicular breath sound. These sounds will be soft, low pitched sound heard over most of the lung areas. We can hear these sounds. Inspiration is longer than the expiration and it indicates the normal lung function. This is called vesicular breath sounds. Second is bronchial breath sounds. These sounds will be loud and high pitched, heard over the trachea and larynx. Those vesicular heard all over the lungs, but these only heard over the trachea and larynx. Here, vice versa. Expiration is longer than the inspiration. So the third one is bronchovesicular, mixed of both breath sounds, medium intensity and pitch, heard over the main bronchi between scapulae and the upper chest. So inspiration and expiration are equal. Okay, next we will move on to the abnormal, that is adventitious breath sounds. Both are same, abnormal or adventitious. Here first we will see wheezing sound. High pitched whistling sound will be there because due to the narrowed airways. Most commonly we can see this whistling sound in the asthma and COPD cases. This is the first abnormal breath sound. Second is crackles, that is rails also we can say. Discontinuous popping sounds will be there in this, caused by fluid in alveoli. There will be accumulation of fluids in the alveoli. Due to that we can heard a popping sound. Those will be discontinuous, not continuous popping sound, discontinuous popping sounds seen in pneumonia, pulmonary edema. Third one is rhonchi. Low pitched snoring or gurgling sound will be heard in this, caused because of mucus in large airways, may disappear after coughing. So we will feel something is stuck in between our throats or lungs. Some low pitched snoring or gurgling, like gurgling type of feeling will be there, and after coughing the sound will disappear. Again after some time it will come. So this is called rhonchi. The fourth one is stridor. Harsh high pitched sound during inspiration, not during expiration, only during inspiration. This high pitched harsh sound will be heard, indicates upper airway obstructions. This is little emergency, medical emergency. So these four are four types of abnormal sounds, breathing sounds. So what is the importance of nursing in learning the breath sounds, normal and abnormal? We can easily detect lung diseases early. Okay, it will help in detecting the lung diseases, guides diagnosis and treatment. So based on the sounds, abnormal sounds and normal sound, we can detect any abnormalities or for the diagnosis purpose and the planning the treatment. Important during respiratory assessment. So this is all about the normal and abnormal breathing sound. Thank you.